If you are a woman in your 40s or 50s and you are in this perimenopause to menopausal stage, your body is changing. There are different symptoms that you start having, and whether that be weight gain, fatigue, memory, brain fog issues, bladder problems, or having some new back pain. All of these symptoms are very common in this stage, and having new musculoskeletal issues and issues with your pelvic floor and bladder problems are very common, but they are very treatable. And today I want to talk about one of the most frustrating issues that women in this menopausal stage go through, and that we treat as a women's health physical therapist. I see a lot of this, and I want women to know there is a solution. So what am I talking about? The bladder urgency or leaking. And in this menopausal stage, why does this even happen? Well, my name is Dr. Dawn Andalone. I'm a pelvic floor specialist and women's health physical therapist. And for the thousands of women that I have helped with different issues in regards to back or hip pain, pelvic floor conditions like prolapse, bladder issues, or pain with intercourse, these are very common in this stage, or maybe you had a little bit of it before, possibly after having children, but now the problem has accelerated and gotten worse, especially as your hormones are changing. Well, this happens because drop in estrogen is going to affect the muscle tone, and it's going to cause some atrophy in the vaginal muscles. What is atrophy? Well, that means that you start getting some muscle weakness, you don't have as much muscle tone, and therefore the hormone levels are affecting that. You also may be more sedentary and not getting as much movement, or been sitting a lot at a job where you're sitting at a desk or computer, or even driving a lot. When you're sitting, this is also creating more pressure and stress around your pelvic floor muscles, and also decondition this area around your core, your back, and your pelvis and your hips. So with those combined, those issues can accelerate having a bladder problem or having a prolapse issue and making your symptoms worse. So I'm going to talk a little bit more about the bladder condition issues and why during perimenopause to menopause, why the bladder issue gets worse and what you can do to help it. So having a bladder issue, this could be called incontinence, stress incontinence, or urge incontinence. Stress incontinence is actually when you're jumping, sneezing, running, you start leaking. Urge incontinence is when you are getting that urge all the time, and you feel like once you feel like you have to go to the bathroom, you can't hold it. You've got to go. You've got to get there now. I've seen women too where they just get up from a chair and it's like their muscles can't control what used to happen where they could control that, but they're getting leakage when they change positions, or as soon as they drink something like alcohol or caffeine, they get that urge to happen rather quickly. So with the changes in your estrogen levels and hormones, plus the change in movements and what you need to start doing for your core and your pelvic floor to add into your exercises, the combination of those two can really solve the problem rather quickly. So what do you need to do? Well, number one is not just do Kegel exercises. I know this is a solution that your doctor probably has mentioned to you. Just tighten those muscles and squeeze those vaginal muscles and do Kegel exercises. Well, for the women who do have some tightness in their hips and lack of pliability in those muscles around your pelvic floor, if you're just tensing and tightening all the time, you're trying to tense already tight muscles, and therefore the muscles can't do their job. So instead, we like to give breathing exercises, yoga type stretches, exercises that are going to open up the pelvic inlet and also stretch the muscles and let the pelvic floor muscles go and relax. This has a brain to body connection. And what does that mean? Well, when you're actually trained on how to let those muscles go subconsciously, it can have a huge change in how your symptoms will evolve and how those muscles can actually contract and how those muscles are used for support, kind of like a basket. So it's supporting your pelvic organs with your bladder, your uterus, your rectum. And the pelvic floor muscles, when those are used when you jump or you're walking or running or when you sneeze, those should automatically, without telling them, it's a subconscious little contraction that happens. Well, if your muscles are already tense and tight, you're not going to be able to do that. And there's a connection that's off between the brain and the muscles. So we need to retrain it again. And doing things like breathing, stretching, some meditative type exercises where you're connecting with your nervous system and allowing those muscles to let go. Therefore, those muscles can learn how to actually relax too, and you don't even realize you're tensing them sometimes. This can also be helped in a huge way by seeing a pelvic floor physical therapist who's going to teach you strategies on how to release and let those muscles go, and even do some hands-on work to assist and help those muscles to be released. It's not as scary and invasive as you're thinking. So that is the first thing, is just learning how to let the muscles go and not just doing Kegel exercises. The next thing is also realizing what triggers your bladder. So if you walk past running water, if you put your key in the door, those types of things can sometimes stimulate that connection with, it's time to go to the bathroom because I just did this motion. And it really is something in your brain that sets off that connection to your bladder saying it's time to go and I can't control it. So we're going to train those triggers. Next time you notice what actually gives you that urge and that frequency over and over again, instead, when you do that, say it's putting your key in the door or pulling up in your driveway, you're going to count backwards from 10. You're confusing your brain, and so therefore it's not going to think about having to go to the bathroom, but instead it's going to think about the actual counting backwards. You can also, on top of counting backwards from 10, you can also do some deep breathing exercises and stop, take a break, maybe sit in your car and do 5 good deep breaths, or stand in place and even cross your legs, not like you're holding it, but you're allowing your pelvic floor to just respond and go, okay, it's okay. I'm not going to let go this time. I'm actually going to breathe. So you're training those triggers to not happen and not have you feel like you have to sprint into the bathroom or that you're not going to leak. So your number 2 is training your brain to those triggers. And then number 3 is doing stretches and exercises that are first going to stretch your hip muscles and around your pelvic muscles. So things like a figure 4 stretch, some yoga stretches. I have some great videos on this channel all about trying to open your hips and do some stretching around your hips. And then also doing some Pilates-based exercises where you're going to be training your core, you're going to be training your pelvic floor with breathing and alignment of your spine over your hips and your pelvis. It's so common when we do spend a lot of time sitting, our hips get really tense and tight, especially in the front, and we're not using our core muscles like we need to. So if you're doing a type of exercise that is switching it up every week where you're not always doing the same type of exercise like running or walking, instead you're mixing in some strength training, whether that's weightlifting, but Pilates is very beneficial for those core muscles to teach your brain how to connect to your pelvic floor and your core. So there you have it. Those are the top 3 strategies of how to help this new symptom of having some bladder issues during the menopausal stage. It's very common, but it's not normal and it can be helped. There are other videos on this channel all about dealing with incontinence and bladder issues and some step-by-step exercises that you can do that don't involve just Kegel exercises. So if you haven't subscribed already, please subscribe. We release new videos every week, and I'd love to teach you more about common women's health questions and topics that will help you age with a more vibrant and active life without relying on medications and surgery. So thanks so much for watching, and we'll see you again soon.